Today's topic is Care Partners Made Simple. As I often say, we don't treat myeloma, we treat people. And as we treat an individual, very often heavily involved with that individual is a caregiver or a care partner, someone who's intricately involved in their life. And today I have the privilege of discussing this topic with an amazing care partner, Robin Tuohy. Robin Tuohy is the Vice President of Patient Support here at the International Myeloma Foundation and is also the care partner to a 23-year survivor with multiple myeloma, her husband, Mikhael Tuohy. Robin, always a pleasure to be with you. And I want you to help us understand a little bit more about this notion of caregiver and care partner. I know we've evolved a little bit in the terminology that we use, but maybe you can shed a little bit of light on that for us.
Yeah, I think it's really important to talk about this because the words matter. And whatever resonates with each person, whether that's care partner or caregiver, then that's right for you. But for me, Mikhael and I have always been a team. And so care partner helps us to feel stronger as a team. And it helps us to support each other through the journey.
That's fantastic. And I've witnessed it, and so I know it to be true. On the subject of this great partnership you've had with Mikhael for so long, what key lessons have you learned? I know you've had some ups and some downs and some very challenging times, but share with us, and for those care partners in particular listening today, what key lessons have you learned over the years to be able to support Mikhael in the way that you have?
Yeah, it changes throughout the years. When you're newly diagnosed, it's really overwhelming. And as you go through and you learn different things, it helps you to navigate this whole new life that you're living together. So for us, support groups were wonderful. We didn't understand, though, that support groups weren't just about sitting around and maybe complaining or whining. It really was about sitting around and talking about what are the treatments? Where are the doctors? What are the resources? What is it like when you're newly diagnosed? What are the questions I should be asking the doctor? And for me as a care partner, we're at that table too, together again. And the care partners share their best tips, what I can learn so I can be my best. And additionally to that, I've also learned through the years when to step back and let things go, and then when to really make sure my voice is heard, because I'm seeing something that's important that I want the healthcare team to be aware of, because our voices do, again, we contribute, we matter at that table.
That's beautifully said. And I think that's really important. I can tell you as a provider how important it is for not only the relationship I have with my patient, but indeed with their care partner. And sometimes that care partner is someone very, very close to the patient, and perhaps someone not so close to the patient. We have a whole series, if you will, of types of care partners, but they can serve as an extra voice at the table, as you've said, to provide information, but also as extra ears at the table as we come to make decisions, as we come to set a plan together, that can be consolidated thereafter. Now, Robin, there was a very interesting and in some ways sad scientific paper that was recently published by Dr. O'Donnell and colleagues looking at the impact of myeloma and its therapy, not just on patients, but on the caregivers, on the care partners. And a few unfortunate themes came through that. One was there is a tremendous level of anxiety in the life of that care partner. And in some care partners, it was even to the point of PTSD or post-traumatic stress disorder. Maybe you can talk to us a little bit about the significance of that and how important it is for care partners not just to be caring for their partner, but to be caring for themselves.
Yeah, this paper, I honestly wish it was done much sooner because it's so important. It allows the care partner to feel like some of these things I'm feeling, anxiety, pressures, whether it's from the finances or from the stress of daily life or feeling responsibility for whatever the treatments are, and do I have, the bottles lined up right, or how do I give this injection? And there's so many different treatment options out there today. So care partners feel stress, and a lot of times they don't want to let that be known. They're keeping a lot of things bottled up, which is never a good thing. And so from my own personal experience, I could share, you really need to take care of yourself. You have to kind of pay attention how you're feeling mentally and physically, and go to your own doctor to share that and make sure that if there is something going on, that you're being treated so you can be your best to continue to be that strong care partner.
Absolutely. It's so fundamental, isn't it, that sometimes you can get lost in the shuffle and the focus can be entirely on the patient when in fact every one of us is a patient at the same time. So Robin, there are times when we as the medical establishment actually mandate the presence of a care partner for the benefit and the safety of the patient, typically in three scenarios: in the context of autologous stem cell transplant, with CAR T cell therapy or chimeric antigen receptor T cell therapy, or even more recently with bispecific therapies. And for each of these, we mandate a care partner because they can detect things usually after the process and the procedure, care for the patient in such a way that if they really need more help, that they can be directed to their healthcare professional. Now, I know you were Michael's care partner during his transplant. Maybe you can tell us a little bit about that.
Yeah, so while Michael's stem cell transplant was in 2002, many of these same principles still apply. So whether my job that day is to sit there and be a cheerleader or to hold his hand and to help him through maybe a rough day and to let him know that the sun is going to come out tomorrow and it's going to be better and I'll be here for him no matter what. And then when you get home, it's a whole different set of challenges because we don't have the healthcare team. I don't have the good doctor and the good nurse there supporting me as a care partner and Michael as the patient. So now when we get home, I felt I was a little bit more of a gatekeeper to make sure that I was doing my best to set up some rules to make sure that I was keeping him safe, because I want this procedure, whatever the procedure is, to give him the best outcome possible.
That's fantastic. That really is a care partner to us as well as the healthcare team, because we rely on you heavily, especially in many of these newer procedures where we're monitoring patients for certain signs and symptoms that may occur, and engaging the care partner becomes really important to us. Well, before we wrap up, Robin, you made reference earlier to support groups and how valuable they have been in your journey with Michael, led you to becoming the Vice President of Patient Support at the IMF. Maybe you can share with our audience a little bit about how they can be connected to a support group if they wish.
Yeah, I will give a selfless plug. Support groups are near and dear to my heart. The leaders are near and dear to my heart. And whether you're newly diagnosed or in the middle of your journey or you've been through a lot of things in your journey, again, it's your voice matters. And coming to this support group, it's about learning and sharing experiences, again, so you can go back and have really important conversations about your myeloma, right? I tell Michael all the time, we joke, it's myeloma, it's your loma, but it's our loma. And that's what we talk about in support groups. And to learn more where a support group is near you, it's support.myeloma.org. And there are so many groups meeting in person, virtually, or even in a hybrid fashion. So check it out. Support groups are so important. They can be a lifeline.
Well, that's fantastic, Robin. Well, thank you so much for your insight today, for the experience that you've been willing to share with us as a care partner for so many years and the role you have here at the IMF. I know it is going to be extremely valuable to our audience. Thank you very much.
Oh, it's my pleasure. Thank you.